My next question is listening. Most of the time, what we have seen, like experienced osteopath, they listen before the treatment.
Yes.
So my question is, what are you actually listening for, and how does that influence your clinical decision?
Yeah. I think the word listen is very important because we tend to have a biases even before we treat. And as we treat, we bring the biases into our treatment. And that's where sometimes things can go wrong.
Yeah, that's true.
So I think when you use the word listen, it is like a moment of pause and just stepping back and then using the senses of touch. Actually, touch is not just the touch, but your whole body that is coming in to feel the body. So if you see what we're listening for, I think listen is through the touch of that patient that we are treating and the information we're getting from our touch. So when we touch, what are we feeling? And that's also a very big question. So if you want to talk about just touching at the different layers of the body, or you want to talk about even when you are about to touch, because some people do respond even before you touch them and they are not comfortable at all. Yeah, because they have that layer of history with them that you need to respect. So listen in the sense is I'm coming in and see what information I'm receiving. That requires quite a lot of concentration without any biases. And that's including myself, of course. So when you feel, what are you feeling for? Are you feeling as simple as just, oh, these tissues feel swollen? Or do you feel like this tissue is very abused? Do you feel like this tissue has this very flat energy? And when you listen that part, it directs you what you want to do or where you want to start. Does that help to understand that a little bit? And that applies across the body. I think listening also means as you're touching, you receive the information.
That's the most important part.
I think that yes. Sometimes you'll be surprised that even patients were amazed by the question that you ask them later on. That's so relevant to them because they never really share with anybody. I have many experiences of that, and I think that is among some of them. Some of my moments, I think it's a milestone for me. Yes.
Like patient came for neck pain and then
and it's not just neck. It's not just about the neck. The neck is always just the area of manifestation. And you need to go deeper. However, while that is true, it does not necessarily mean that the neck is not the problem. Because sometimes the neck is exactly where the problem is and where the symptoms are manifesting. But if we come back to the original question about listening, I think it's a lifelong process of learning about listening.